Hello, everyone. My name is Tina Park, and I'm the head of Inclusive Research and Design at the Partnership on AI. I'll be presenting our paper, Automating Care, Online Food Delivery Work During the COVID-19 Crisis in India, on behalf of myself and the lead co-author, Anubha Singh, a PhD candidate at the School of Information at the University of Michigan. On March 23, 2020, the government of India announced a nationwide lockdown to curb the spread of COVID-19. The country came to a standstill overnight, and small businesses and restaurants took a massive financial hit. The unknown nature of the virus and its spread deepened anxieties among the general public, quickly turning into distrust towards any outside contact with goods and people. India's two food delivery giants, Zomato and Swiggy, acted quickly to respond to customers' fears and anxieties. They implemented several digital health and safety interventions on their delivery platforms, such as contactless deliveries and payments, sharing delivery workers' body temperatures, and the publication of delivery worker vaccine records. Through interviews with 13 food delivery workers, we examined how Zomato and Swiggy's strategic deployment of care, primarily to reassure and regain their customer base, came at the expense of the safety of delivery workers. In our analysis, we foreground the direct experiences of food delivery workers while asking the following questions. Firstly, how do companies optimize the use of quantified data to quickly implement care practices on their platform? Second, how do differences in power between delivery platform companies, customers, and workers affect the practice of care? And finally, by normalizing the performance of care via these platform apps, what unseen costs are being borne by workers and society more broadly? We analyze these digital interventions to more closely examine how care, trust, and safety are operationalized and enacted in the platform economy. We interrogate who benefits from the changes and who carries the burden of enacting them, and find asymmetries between the food delivery platform companies, its customers, and the delivery workers. What first appears to be practices of care are instead revealed to be performances, which prioritize an efficient exchange of good feelings between the platform company and the customer, rather than implementing solutions that ensure everyone's safety. While care has largely been understood as a private act and responsibility within the domain of the home and family, in our analysis, we follow feminist calls for making care a political project and bringing it into the public domain, making it a social issue, and attending to its non-innocent politics. Our work identifies that care is rooted in hegemonic structures like racism, classism, casteism, sexism, and ableism. In India, the reality of gig work is marked by caste and class divide among its customers and workers. While the two food delivery platforms portray themselves to be caste and class agnostic, the erasure of caste distinction is neither a move towards castelessness nor growing social acceptance. It instead obfuscates the long history of gig or informal work in the Indian economy, largely held by those with no or low caste and class status and no economic security or collective power, thereby disassociating contemporary gig worker labor issues from its long history of exploitation. Care during the time of COVID-19 is especially important to unsettle because the gravity of the dangers can easily mask, if not justify, the surveillance of workers and the pathologizing of particular segments of this population as diseased and dangerous. As I mentioned, by mid-March 2020, when India's Prime Minister Narendra Modi announced a total ban of coming out of homes, Zomato and Swiggy had already started to implement contactless delivery practices. In both instances, the primary objective of contactless deliveries, as emphasized by the two companies, was to maintain a safe physical distance between customers and the delivery workers, thereby minimizing the likelihood of contracting the disease through food delivery. Due to initial speculations about fomite or touch-based transmission, Zomato and Swiggy encouraged customers to also use contactless payment options as well, connecting online bank accounts to the app to complete payment in lieu of cash payments for deliveries. Both contactless deliveries and payments were measures taken in accordance with the public health guidelines and promoted the protection of customers, as well as restaurant and delivery workers. Delivery workers face additional measures in the name of public safety. Swiggy and Zomato workers, for example, were required to download the COVID-19 contact tracing mobile app, Aarogya Setu. The contact tracing app is one of the Union government's main strategies for timely identification and prevention of the spread of COVID. It relies on a user's smartphone's Bluetooth and GPS features to track COVID-19 cases within a geographic area, identifying any potential hotspots by scanning through a database of known cases. However, despite its public-oriented intentions, the app is not without controversy and has raised serious privacy and data protection concerns among civil society advocates. Zomato and Swiggy also monitored workers' mask-wearing practices through already available in-app mechanisms, such as live selfie requests. Worker selfies have been a required component of platform delivery work prior to the pandemic as a means of addressing worker fraud, particularly the issue of unsanctioned individuals operating off of a single worker account. Swiggy and Zomato, having adopted a similar mandate for its delivery workers, extended the purpose of the mechanism as a means to check for correct mask-wearing practices. The selfie requests would be sent to the delivery workers at random intervals and had to be completed within a very small window of time, usually less than a minute. Failure to upload a selfie on the app within the given time period would result in fines and penalties for the workers. And while facial recognition technology and platforms is typically used for identity verification, by 2021, Swiggy announced that it was also using computer vision technology-enabled automated verification of both correct mask wearing and the use of Swiggy gear, such as wearing a Swiggy t-shirt and using the Swiggy bag when making deliveries. By April 2020, the food delivery platforms announced that they would be sharing body temperatures and health certificates of restaurant staff and food delivery workers to ease customer anxiety. For this, Zomato and Swiggy partnered with local restaurants to check food delivery workers' body temperatures at the time of order pickup and report it on their end of the delivery platform. It became the responsibility of the restaurants to ensure that the food order was not handled by any delivery worker whose body temperature was above normal. The delivery worker's body temperatures recorded by the restaurant was then made available to the customer through the app. As you can see, Swiggy placed the worker's reported temperature towards the bottom of the screen on the app. In the Zomato app, the delivery worker's body temperature could be seen hovering above the tiny figure on the app, also depicting the delivery worker's physical movements. After the development and distribution of a vaccine, Swiggy and Zomato announced initiatives to encourage and assist delivery platform workers to become vaccinated, going so far as to boast near perfect vaccination rates amongst its delivery workers. To reassure customers their delivery person is vaccinated, delivery workers had to upload their unredacted COVID-19 vaccination record to the app, and these records were then made available to customers. Each of these initiatives would indicate a robust practice of care on the part of Zomato and Swiggy. They made rapid changes to how their platforms and their affiliated partners, such as restaurants and delivery workers, operated in order to align with public health guidelines. However, closer examination reveals significant asymmetries in the care shown to delivery workers versus customers, as well as a focus on efficient care practices. Rather than being genuine demonstrations of care based on the desire to serve and address issues in a way that can benefit and heal all involved parties, the primary objective was to generate good feelings of trust and safety among customers towards the delivery platform companies. The focus was primarily on customers in order to reassure them of their safety and entice them back to the app. At a time when there was great uncertainty around the origins and transmission of the disease, the changes adopted by Zomato and Swiggy, as well as the messaging used to communicate these changes to their customers, served to position workers as a danger to public health, requiring constant monitoring and surveillance. Ultimately, this has led to further normalization of constant automated monitoring of worker behavior while being rationalized as being for the greater good. As the pandemic progressed, safety measures were instituted and enforced differentially and with limited resources to support the success of such protective measures. Our findings show that much of the responsibility for the public safety related to the delivery of food landed on the shoulders of the food delivery worker. As this quote from a delivery worker highlights, workers were expected to take several steps to prove they were uninfected or at least asymptomatic. As mentioned earlier, delivery workers had to log in and have running in the background of their GPS-enabled smartphones, the government contact tracing app. They had to sign daily declarations stating that they were not experiencing any COVID-19 symptoms. Correct mask usage was mandated and monitored. They experienced persistent reminders on the app to adhere to public safety guidelines. Customers, on the other hand, were not required to adhere to any such safety protocols. For a customer to use Zomato or Swiggy, they did not have to simultaneously run Aarogya, Setu, or any other contact tracing app. While a delivery worker's COVID status could be monitored and traced by customers, no similar information was available on the app to reassure delivery workers that the customers were also healthy or asymptomatic. Customers did not receive any reminders about sanitizing their hands or wearing masks while meeting their delivery person. If a customer arrived at their front door without a mask, delivery workers had no means of enforcing this public safety feature. Customers could not be reported or have their access to the platform temporarily revoked or limited if they repeatedly failed to adhere to public safety guidelines. On the other hand, as this quote from a worker highlights, failure to adhere to contactless delivery resulted in punitive measures for the delivery worker in the form of additional labor and delays, while the customer was unaffected. In this case, they had to take multiple photos, change the type of delivery status it was, so that they could complete the order. Workers could find themselves facing fees for public health infractions, or worse, being temporarily barred from working through the app. The emphasis on customer perception and the excessive focus on the delivery worker is more indicative of increasing worker surveillance and control rather than care for either the worker or the customer. Instead, Zomato and Swiggy indulged in internet thinking for scaling trust that operates through a form of information exchange and relies on precision-oriented measurements like body temperature that could be standardized and controlled. We show that rather than being genuine demonstrations of care that follow public health mandates to keep all involved parties safe from the threat of a highly communicable disease, platforms primarily focus their efforts on increasing surveillance of delivery workers and making this tracking visible on the app to increase a sense of safety and trust among customers. We demonstrate how this performance of care focuses excessively on workers' health through increased surveillance and monitoring of their laboring bodies. For this, the platforms appropriate existing scientific knowledge about COVID-19 and quantify and standardize workers' health into easily trackable and visualizable indicators to be efficiently and quickly incorporated into the existing platform. In our paper, we highlight how the celebration of good feelings like safety and trust, when accessible differently across social strata, is not only a problematic asymmetrical distribution of actual care, but also the dangerous reanimation of structural inequality. Feelings of care and safety have the potential to make underlying discriminatory practices appear ambiguous and fuzzy, if they appear as problematic at all. Through a critical unpacking of Zomato and Swiggy's performance of care, our work brings attention to the importance of critically interrogating the promises of happiness, care, trust, and safety of technological systems. We therefore advocate for a critical understanding of what is assumed and what is ignored, and the resultant human cost that can go into the characterization of fairness, accountability, and transparency in social computing and HCI. Thank you so much for your time. If you'd like to reach out with any questions or thoughts about the paper, this is our contact information.